The Alberta Health and Care Insurance Amendment Act, an innocuous name, for a bill that, Madam Speaker, is a sign of the failure of this government, a significant failure that has done significant harm to the Alberta healthcare system and Albertans' ability to access care. I join the minister in thanking the 11,000 physicians who serve Albertans. I absolutely agree that a collaborative relationship with those physicians should be a top priority. However, it was not this government's priority when they passed Bill 21 in the fall of 2020 and awarded themselves the sweeping power to tear up the master agreement between the Alberta Medical Association and the Government of Alberta. The minister said he is bringing forward this bill today because that legislation that they passed that fall is no longer required. Madam Speaker, I would contend it was never required. The government did not need that nuclear option, particularly given that the master agreement that this minister just congratulated himself and his government for signing could have easily been negotiated at the table in 2021. It did not require the government tearing up a master agreement and embarking on a 2-year campaign of attack against physicians in the province of Alberta, one that again has done significant harm to our public health care system and has hurt Albertans' ability to access care. This government chose to press forward with an aggressive plan that certainly to all appearances appeared to be an attempt to break the Alberta Medical Association and pit physicians against each other. A cynical ploy, Madam Speaker. Part of an overall aggressive posture which this government struck at that time and continued throughout the pandemic against healthcare workers, and particularly the individuals that those healthcare workers elect to negotiate on their behalf and represent their interests. So let's talk about how this came about, Madam Speaker. Let's look at a little bit of the history. As I said, in the fall of 2020, this government passed Bill 21, awarding themselves the power to tear up the master agreement with physicians. Shortly after that, or around the same time, the then Minister of Health, now Minister of Justice, put forward 10 proposals to the Alberta Medical Association for changes that he insisted were essential to cut costs and save dollars in the healthcare system. That included things like making changes to the complex care codes that allow doctors to spend more time with their patients, ending the practice of good faith billing, which allows physicians to be able to bill for looking after a patient even if that patient does not have their Alberta healthcare insurance card with them or have their number. That is something that is used significantly by physicians, for example, say at the Royal Alex Hospital here in my constituency, when they are dealing with individuals who are living houseless and do not have ID. They insisted they had to impose a cap on the number of services a doctor could provide a day, or also known as a visit cap. They insisted that they had to end coverage for drivers' medicals for seniors. Doctors reached out to me. They expressed a lot of concerns, particularly family doctors, Madam Speaker, about the impacts this would have on their ability to continue to provide care, and particularly rural physicians, Madam Speaker, had deep concerns with some of the other things this government was trying to force through around charging them for facility fees and other things that would make it harder for them to be able to practice in the community and in hospital. But these were things the government insisted were so essential that they had to pass legislation awarding themselves the power to tear up the master agreement, and went ahead and did so in February of 2020. Pardon me. I apologize. I've been speaking of 2020, fall of 2020 with Bill 21. It was about fall of 2019. February of 2020, they tore up the master agreement. I apologize, Madam Speaker. This was a long war, so it's easy to get confused on the dates. They proceeded, after tearing up that agreement, to go on an aggressive campaign against doctors on social media, accused them of being greedy, accused them of being entitled, skated right up to the line of accusing them of engaging in fraud on their billing. There was a government website under Alberta Health making these contentions. Many tweets from the then Minister of Health, who now serves as the Minister of Justice. This as we found ourselves going into a global pandemic. And as we went into that pandemic, the minister talked about how happy he is about supporting primary care and the steps he's taking. Well, you know, going into that pandemic, family doctors in Alberta were begging this government to take action on providing them with a code to be able to provide virtual care, because we were locking down and individuals were not able to go and see their family doctor in person because we were at the first wave. We did not know what the parameters were. That was the situation. So this government said, sure, no problem, we will give you $20 for a visit, which is half, approximately, Madam Speaker, of what doctors normally earned in clinic. Other provinces were stepping up and providing fully funded virtual codes. This government told doctors you can have half of what you normally make. They let that sit for weeks, at the same time as they had just signed an agreement with TELUS for their Babylon phone service for people to be paid full. Doctors on Babylon were paid the full amount, $37 for a visit, Madam Speaker, while this government was grinding Alberta family doctors down at half that rate for the same provision, the actual doctors of the patients who knew their histories as opposed to an anonymous walk-in doctor through an app. That is what we had from this government towards physicians in the province of Alberta. We had a minister that went to yell at a doctor in his driveway. The pushback was bad enough that when this government forced its new physician funding framework through in April, they ended up having to walk back portions of it on April 24th because their own MLAs pushed back so hard against their minister's wrong-headed approach and the feedback, the blowback they were getting from their rural constituents and rural leaders, because multiple physicians across the province were threatening to withdraw service. And you know what? A number of those physicians did end up picking up and leaving, Madam Speaker. We lost a number of family doctors across the province as this government continued with its war on physicians. They threatened the funding for physicians' benefits and support programs, Madam Speaker. They seized control of them from the Alberta Medical Association and then threatened the continuance of funding. These are for things like mental health supports for physicians in the midst of a pandemic, Madam Speaker. That is the position this government took and pushed for months, all empowered by what they passed in Bill 21, the section that they are repealing today. And as physicians began to say, well, forget it, I am not going to work under these conditions, the Minister of Health, now the Minister of Justice, went to the College of Physicians and Surgeons of Alberta to demand that they change their rules to make it harder for physicians to be able to leave an abusive relationship. That is the context for the bill that we are looking at today. And it's not just family physicians, Madam Speaker. This government continued up until this year to put pressure on Alberta Health Services to force contract changes on hospitalists that at more than one occasion, to my understanding, led to near-job action that would have impacted the ability for Albertans to access surgeries and required the direct intervention of this Minister of Health to prevent. Hospitals like the Red Deer Regional Hospital are still not able to maintain, regain the surgical capacity they had before the pandemic due to a shortage of anesthesiologists. You know, in March 2021, I spoke with physicians at the Red Deer Regional Hospital. They told me they'd lost about 6 anesthesiologists in the previous 3 months. Spoke with another anesthesiologist here in Edmonton. Just this past June, he noted that we currently have about, in his estimation, about 350 FTE anesthesiologists, so about 450 actual, maybe, but some of those are part-time. He said that's about 15% short of what we need to get back to pre-COVID capacity. And he noted that, in fact, we have continued to lose anesthesiologists from Alberta to jurisdictions like BC, Vancouver, Victoria. He said about 12 anesthesiologists in the previous year to year and a half, because other jurisdictions are actively headhunting those physicians from Alberta, and they were leaving in part due to the chaos created by this government, by their decision to pass that element of Bill 21 and go on their extended war against physicians. And indeed, I've even heard reports that the Royal Alexandra Hospital here in my constituency will be short about 2 anesthesiologists through till next September. So the fact is, Madam Speaker, that the deal that this minister signed, now I will give the minister credit. This minister did work hard. He had to, because he inherited a mess. He inherited a flaming dumpster left behind by the now Minister of Justice, former Minister of Health. And this minister indeed had to spend those 2 years undoing that damage, and it was significant damage. And I would say that damage is yet to be fully repaired, either in terms of the damage it has done to our healthcare system, Alberta's ability to access care, and indeed trust with physicians in this province. To be clear, the minister talked about how happy he was about the level of support he got for this agreement. Let's not forget the agreement that was brought forward by the previous minister and was soundly rejected by physicians, because they did not trust this government. And indeed, this minister was left with that mess to have to clean up, and I will give him credit for getting to that 70% support of the physicians that signed. And certainly I am happy for physicians that they are in a better position. That lump sum payment for family doctors, that is certainly welcome, Madam Speaker, but it does not make up for this government's grinding them down throughout the midst of a pandemic, refusing to provide them with a proper virtual code, which again was another step that I will say this minister did move forward on and did put through in January 1st of this year. But again, he was undoing the damage that his own government had done. So now we know we have tens of thousands, if not hundreds of thousands of Albertans who are struggling to access a family doctor. The minister rose and spoke about bringing family doctors into Lethbridge today. That's wonderful. I look forward to seeing those doctors actually get out and working in the community. But it would have been far better if they'd never been driven out in the first place. The minister has talked about the work that he is doing with Alberta Health Services to recruit anesthesiologists to the province of Alberta. I believe him. I believe they're in fact doing that work. Now, talking with a local anesthesiologist, that work has been incredibly difficult and continues to be incredibly difficult, and it is because of the damage this minister and his government did before. So again, I'm not discrediting the work that the minister is putting in. Absolutely, I believe he is working hard, and again, pretty much he has to. Because this government is simply making up the deficit, filling in the hole that they dug. And that has cost Albertans. Currently in the Bow Valley, there is not a single doctor that is accepting new patients. We're still waiting for those physicians to get in and fill that significant gaping deficit in Lethbridge. There are still clinics that have closed and have not reopened. We have significant challenges across our system, and of course we are seeing those impacts now as we see these surges in ERs across the province. We're continuing to see the challenge now because Albertans can't get to a family doctor, so then they turn to their local emergency room. And unfortunately, that leaves us in a position then where those emergency rooms are overcrowded, they are overflowing, and we do not have the capacity because, of course, this government, through its policies during COVID-19, exhausted the healthcare workforce. Not just doctors, nurses, and many others throughout the system. And we have a critical staffing shortage in pretty much every area. Now, the minister, again, I'm sure if he were to rise now, would point out that this is the case in every jurisdiction across Canada, that there are critical staffing shortages. But that does not excuse the fact, Madam Speaker, that at every step this government made it worse. The fact that other jurisdictions are also struggling to find doctors does not give this government a good reason to go on a war against them and take all of the steps I have outlined today, that aggressive posturing, that attempt at what could be colloquially called union busting. Although, of course, the Alberta Medical Association is not actually a union, though certainly the government tried to paint them that way. So the fact is, yes, other jurisdictions are struggling, but Alberta is the only jurisdiction where the government has consistently been at war with physicians and has consistently attacked other healthcare workers over the course of the pandemic and indeed the majority of its term. So the minister can stand now and he can offer thanks and he can talk about how much he appreciates what physicians are doing. And you know what, Madam Speaker, I don't even doubt that the minister means it. My understanding, and certainly what I've seen of this minister and what I've heard from his work in the negotiations, he is a decent man. He is personable, he is genuine. But he was part of the government that voted at every single step to take each of these steps that occurred. He continues to sit directly beside the minister who undertook so many of these detrimental actions, and I've never heard that minister offer any apology or acknowledgement of any of the actions that I've listed today. And they are not hyperbole, Madam Speaker. They are not political drama. They are not theater. They are fact. And you can ask any physician in the province of Alberta about that. It was a wrong-headed strategy. It was a cheap tactic, one that this government could have chosen to abandon at any point during the pandemic. But instead, they chose to press on, they chose to continue to fight, they chose to continue to belittle and pressure physicians, and then force this minister to spend nearly 2 years cleaning up that mess, to get us back to where we are today, where we find ourselves in the midst of a health care crisis. And Madam Speaker, you know what? Some of the steps this minister is taking on primary care, I don't disagree. Sitting down at the table, having committees of actual frontline health care workers, actual family physicians to provide recommendations on making the system better, an excellent idea. It would have been an even better idea 3 years ago. It would have been an even better idea to have done that before they chose to tear up the agreement with physicians in order to force through changes. And you know what, Madam Speaker? Every one of those changes I noted, except for one, all of those things that they declared were absolutely essential, that they had to tear up that agreement, the new agreement with physicians walks back every single one, except they're still charging seniors for driver's medicals. They're still happy to sort of force seniors to pay for that. Aside from that, the visit cap, gone. Virtual codes, addressed as of January of this year. Changes to complex care codes, well, those got killed fairly early on because their own members rebelled so hard against their health care minister. There was nothing gained for 2 years of attacks on physicians, grinding family physicians down, forcing closures, stress and anxiety on them, their staff, their families, and not only family physicians, physicians of all types and stripes, Madam Speaker. Not a single thing gained for this government, not a dollar saved, not a single benefit for Albertans, didn't help them get any better care, nothing gained. So will I support Bill 4? Absolutely, I will support Bill 4 because this is the right thing to do. It would have been far better if the government had never done it in the first place. So I will support undoing what is frankly an embarrassing and ghastly mistake on the behalf of this government, one that has done incredible damage to our public health care system and to the ability of Albertans to access care. It is a black spot on the history of government relations with health care workers in this province. So I will absolutely support a bill undoing it, but I will not give this government any credit for doing so. I owe that much, I think, to all of the Albertans who have been impacted, and certainly to all of the many physicians I spoke with over the last 3 years who suffered, and I do mean that literally, suffered under this government, under the most difficult of circumstances, and people that we essentially need. We are absolutely essential to getting us out of the hole that we are now in with our healthcare system. So I certainly hope that all members, and I'm sure they will, are going to support Bill 4. And I certainly hope that this marks a shift in this government's approach. I don't trust that's necessarily the case, given a lot of what I've heard from this Premier about her thoughts on primary care. But we have an election next May. I'm sure this is not going to be far from the mind of an awful lot of Albertans, the legacy and behavior of this government. Thank you, Madam Speaker.